Hello and welcome to our new topic. Today we will be discussing one of the most widely used and clinically impactful drug classes in medicine, the beta blockers. Their importance lies in their ability to reduce cardiac workload, control rhythm, and improve survival in several major diseases. So, let's start. The learning objectives are shown. Please take a look. The objectives emphasize classification and mechanism, which are particularly important here because beta blockers are not a uniform group. Their differences in receptor selectivity, pharmacokinetics, and additional properties directly influence their clinical use. The goal is to move beyond memorizing drug names and instead develop a framework that allows prediction of therapeutic effects and adverse outcomes. This classification reminds us that beta blockers are part of a broader group of drugs that reduce sympathetic activity. Some act centrally, others peripherally, and beta blockers represent a major subset of peripheral receptor antagonists. This context is important because it situates beta blockers within the overall strategy of controlling excessive sympathetic activity. Beta blockers act by competitively inhibiting beta-adrenergic receptors. This prevents catecholamines from exerting their effects, particularly on the heart and kidneys. The result is a reduction in heart rate, contractility, and renin release. These changes collectively reduce blood pressure and myocardial oxygen demand, which explains their central role in cardiovascular therapy. Understanding what beta receptors normally do is essential before considering their blockade. Beta-1 receptors increase heart rate and contractility, while beta-2 receptors cause bronchodilation and smooth muscle relaxation. Blocking these receptors therefore produces the opposite effects, slowing the heart and potentially constricting the airways. This duality is key to both therapeutic benefit and adverse effects. Beta blockers primarily act by competitively blocking receptors, but their effects extend beyond simple antagonism. By reducing renin release, they influence the renin-angiotensin-aldosterone system, contributing to long-term blood pressure control. Some agents also possess additional properties such as partial agonist activity or membrane-stabilizing effects, which modify their clinical profile. Beta blockers vary widely in pharmacokinetics, including volume of distribution and half-life. Some act for minutes while others last for a full day. Genetic factors such as cytochrome P452D6 polymorphism can influence drug metabolism, particularly for important drugs like metoprolol. These differences are clinically important when tailoring therapy to individual patients. The classification system reflects multiple dimensions, including receptor selectivity, intrinsic activity, and additional membrane effects. While this may appear complex, it essentially describes how selectively and how strongly a drug interacts with beta receptors, and whether it has additional pharmacological actions. This detailed table provides a structured overview of beta blockers based on their properties. Non-selective agents affect both beta-1 and beta-2 receptors, while cardioselective agents primarily target beta-1 receptors. Mixed alpha-beta blockers add another dimension by influencing vascular tone. Understanding this classification allows precise matching of drugs to clinical situations. The ability of beta blockers to cross the blood-brain barrier influences their central effects. Lipid-soluble drugs can enter the CNS and may cause neuropsychiatric effects, while less lipid-soluble drugs remain largely peripheral. This distinction is important when considering side effects such as depression or fatigue. The primary clinical effects of beta blockers are seen in the cardiovascular system. By reducing heart rate, contractility, and conduction, they decrease myocardial oxygen demand and improve efficiency. This makes them particularly useful in conditions such as hypertension, ischemic heart disease, and arrhythmias. One should also keep it in mind that circulating catecholamines may bind with alpha-1 receptors and cause vasoconstriction, leading to paradoxical hypertension in some patients. Beta blockers also influence metabolic processes, including lipid metabolism and glucose regulation. Their effects on glycogenolysis and lipolysis require caution in diabetic patients and those suffering from dyslipidemia. Beta blockers also muffles two important signs of insulin-induced hypoglycemia: tachycardia and tremor. Hence, non-selective beta blockers should be given with caution in insulin-dependent diabetes mellitus. The adverse effects of beta blockers are largely predictable based on their mechanism. Excessive cardiac suppression can occur, particularly when combined with other drugs that reduce conduction. Bronchoconstriction is a major concern in asthmatics with non-selective agents. These effects highlight the importance of receptor selectivity in clinical use. Beta blockers may worsen vasospastic conditions and cause paradoxical hypertension as discussed above. Additional adverse effects include masking of hypoglycemia, which is particularly important in diabetic patients as discussed above. Central effects such as depression and fatigue may occur with lipid-soluble drugs. These side effects reflect the broad physiological influence of beta receptors across multiple systems. Beta blockers play a central role in managing cardiovascular disease. They reduce blood pressure, improve survival in ischemic heart disease, and are essential in controlling arrhythmias. Their use in heart failure represents a major shift in understanding, where reducing sympathetic overactivity actually improves long-term cardiac function, although this is seen with some beta blockers only. Beyond cardiovascular disease, beta blockers are used in a variety of conditions including migraine prophylaxis, anxiety, and hyperthyroidism. Their ability to reduce sympathetic symptoms makes them valuable in situations where excessive adrenergic activity contributes to disease. Thanks for watching. Don't forget to like, subscribe, and share. Happy learning!